Recently, some data were published that strokes appear more frequently nowadays in younger people, in particular in younger women, the ages between 40 and 60 years of age. And that has been backed up by other studies over the last 2 years. So what is the reason for that, and is there any way to prevent that? So a stroke in general means there is damage in the brain caused by lack of oxygen. And the reason usually for this lack of oxygen could be an occlusion, a blockage of one of the arteries in the brain caused by risk factors such as diabetes, smoking, high blood pressure over years. Or more often we see a stroke as a result of an acute occlusion of an artery in the brain caused by a clot which comes out of the heart. And that's the main reason in particular in young people. So you might not have high blood pressure, you might not have calcification in the arteries, but if you have certain irregularities of the heart, for example atrial fibrillation is one of those, which can form clots within the heart, and those clots then can be shot up into the brain, can occlude the blood vessel and cause a stroke, meaning damage. And that damage could appear in different forms, either a minor damage, or in some cases people can be paralyzed on one side, or they lose the ability to see or to speak, among other damages which are possible. So especially we see now more and more stroke cases in young women. So if we see a stroke, or what we call a TIA, a transient ischemic attack, which is a stroke which lasts usually less than 24 hours, meaning symptoms of a stroke lasting less than 24 hours, that does require to evaluate for the source. Why does this person have a stroke or a mini stroke? And this includes, of course, a complete evaluation of the heart rhythm, and we have to make sure there's no clots in the heart. So whenever you or someone in your environment has symptoms of a stroke, make sure they are checked by their doctor, they have to be seen by a neurologist and by a cardiologist. More to come.